This is very important topic. Static stability of the shoulder joint. Static stability of the shoulder joint. Simply we can say that static stability of the shoulder joint in dependent arm. Dependent arm. What it means, suppose one person is there, he is in standing position, okay. So if he is not carrying any weight, through his upper limb, through his hand, that is nothing but the dependent arm. So here arm will be in resting position. If the arm is in resting position, how the shoulder joint will be in the anatomical same position, that is nothing but the static stability. So if we see, this is our scapula, this is our head of the humerus, okay, head of the humerus. Here we will having ulna radius, then here we will get the remaining upper limb. So in this static stability, without doing anything, otherwise without carrying any weight, how the humerus is in contact with the scapula, that is nothing but the static stability. Which structures, which things are helping to humerus to keep with the connection with the scapula, that is static stability. First one here we'll see rotator interval capsule, this structure which is going to help. And second one, orientation of scapula and humerus, and third one, capsule, joint capsule. We will explain one by one and we will understand. First structure, rotator interval capsule. Suppose if we take this is glenoid cavity of the scapula. Here will be having coracoid process, okay. This is glenoid cavity of the scapula. Here will be having the head of the humerus. This is our head of the humerus. So if we see a joint should be having the joint capsule. One joint capsule is going to cover the entire joint. So in this joint here capsule, we will say this portion is superior joint capsule. This portion we will say that this is inferior joint capsule. Anteriorly we can say anterior joint capsule, posteriorly we can say posterior joint capsule. So these are the structures of the capsule. After the joint capsule, here if we see superiorly, here we will be having the ligaments between humerus and scapula. So here one ligament, this is superior glenohumeral ligament. Here we will be having one ligament, this is middle glenohumeral ligament, and here we will be having one ligament, that is inferior glenohumeral ligament. So here we will be having the three ligaments, and one more ligament. Here I said this is coracoid process. One ligament will be present between the head of the humerus and coracoid, that is called as the coracohumeral ligament. Now we'll see what is this rotator interval capsule. Rotator interval capsule is nothing but the combination of the superior joint capsule, after that superior glenohumeral ligament, after that coracohumeral ligament. It is the combination of these three structures. Superior joint capsule, after superior glenohumeral ligament, after superiorly coracohumeral ligament. It is the combination of rotator interval capsule is the combination of these three structures which is present superiorly over the glenoid, superiorly over the shoulder joint. Now we will see how it will help in stabilization of the shoulder joint. Suppose if we take this is our scapula. So here scapula we are having, here we have the head of the humerus. Imagine this is our rotator interval capsule. We discussed superiorly, it will be there. So if the arm is dependent, what is the point here? If the arm is dependent, what is the point here? The gravity will act on the humerus. If you are standing, if the person is in standing position, on the earth, gravity is to understand this segmental center of gravity. Usually gravity will be at the S2, anterior to the second sacral vertebra. After that, if we see segmental center of gravity, means for each and every segment of the body will be having the gravity. Suppose if we take upper limb as one segment, then gravity will act on the upper limb. That is what here. So gravity will act downward from the head of the humerus. Gravity will act. So here the point is line of gravity. So here gravity, imaginary line for gravity is line of gravity. So here the point is the ground gravity is pulling, ground gravity is pulling the arm downward, when the patient is in resting position. Okay, it is pulling downward, but if it is pulling, humerus should come down, but if it is not coming, that means some other force is stopping this gravity force to keep humerus in anatomical position with the scapula, so that force is nothing but the rotator interval capsule. So this force will be acting in this direction. This rotator interval capsule which is present here, it will act in this direction. If we see concurrent force system, in the concurrent force system, if we take forces, here we will draw one parallelogram, so then we will see one resultant force. So same like that only, here what we will do, for this force resultant force, so not resultant, for parallelogram, and for this force one parallelogram. So then the resultant force will be in this direction, resultant force, or we can say resultant pull. So one force is acting in this direction, that is line of gravity. To oppose this, here rotator interval capsule is acting in this direction. Because of these two forces, the resultant pull will be in this direction. It is nearly here. Resultant pull will be like this. So it is nearly to the center of the joint, center of the shoulder joint. So because of the presence of the rotator interval capsules, it is pulling the humerus into the center of the glenoid cavity. So by the presence of rotator interval capsule in our shoulder joint, we are getting the static stability. Understand the point? We are getting the static stability. Second, will come to orientation of the scapula and humerus. If we see orientation of the scapula and humerus, suppose if we see this is the spine, suppose we are seeing posteriorly, this is the spine, scapulas will be like this, on the patient, scapulas will be like this, then here humerus will be there, so here we will be having sacrum, hip bones, then we will be having the femur bone. So this is posteriorly we are seeing. So here if we observe the orientation of the scapula, here the orientation of the scapula will be upward tilt. Scapula will be like little upward tilting. Because of the upward tilting, see here, because of the upward tilting of the scapula, because of upward tilting of the scapula, the head of the humerus will set, otherwise will rest, otherwise it will sit inside the glenoid fossa. So by this orientation, scapula superiorly tilted, otherwise upward tilted, because of the orientation of the scapula and humerus. When the arm is in dependent arm position, it is giving the static stability to the shoulder joint. And last point, capsule. If we see capsule, so here we discussed already, this is our glenoid fossa. Here we will be having the head of the humerus. It will be covered by a capsule, that is joint capsule. Already superior capsule is going to help in the rotator interval capsule. So now entire this capsule, what is the specialty of entire this capsule? This entire capsule is nothing but it is a tight seal to the joint. It is a tight seal to the two articular surfaces. Simply we can say it is a tight air seal. It is a airtight seal to the joint. It is going to make connection between two articular surfaces. After that, here inside this capsule will be having the negative intra-articular pressure. Because of this negative intra-articular pressure, here inside the joint, because of negative articular pressure, vacuum will create. Because of this vacuum pressure between two articular surfaces, head of the humerus will be in connection with the glenoid cavity of the scapula. So because of presence of RIC, rotator interval capsule, and orientation of the scapula and humerus of that capsule, because of presence of these three structures in the shoulder joint, we are getting the static stability to the shoulder. Here there is no involvement of the muscles, because electrically when the person is in resting position, electrically all muscle activities are silent. So that's why when we are getting static stability, that means when the person is in resting position, that time rotator interval capsule, orientation of scapula and humerus and capsule, these structures are going to provide the static stability to the shoulder joint. Suppose in some situations if these structures are not working properly. If these structures are not working properly, that means some injury happened to joint. That's how that time. See, here we are having the glenoid cavity. Here we are having the glenoid cavity scapula. This is our head of the humerus. Head of the humerus. So here, Koraka, here one muscle will attach to the scap. One muscle is attached to the humerus. That muscle is supraspinatus muscle. Supraspinatus muscle. This is the only one muscle which will help in the shoulder stabilization if these structures are not working properly. So that time, see, this muscle will come from the superior supraspinatus fossa. This muscle will come from the supraspinatus fossa of the scapula, and it will insert to the greater tuberosity of the humerus. So the orientation, see, from here it is coming, from here it is coming, it will insert like this. So the presence of this muscle also is going to helpful to keep head of the humerus in connection with the glenoid fossa. So this is muscle also will help in the static stabilization. So this is about static stabilization. RIC, rotate interval capsule, orientation of the two bones and capsule, these are going to work to provide static stability to the shoulder. Clear?